Hi, everyone. It's such a pleasure to be on this call today about a topic that is critical and near and dear to my heart, equity for working mothers. And I'm really privileged to be able to talk about the standpoint of being a Black mother. I am a new mom. This is a new experience for me, and it's been a roller coaster for the past year. I think it's very important to start this conversation talking about the inequity in healthcare and the risk that Black mothers face when they are pregnant or in labor, and the mortality rate for Black mothers is worse than any other race, and the mortality rate for mothers in the USA, because it's driven by the mortality rate for Black mothers, is actually one of the worst rates in any of the major developed countries. And this is a real issue to tackle because um, nobody should be at risk of death because they're bringing life. And so while mortality is the main number that the main statistic that's driving those numbers, there are a bunch of challenges along the way, some of which I experienced myself, that can be eliminated with more fair practices, elimination of certain biases, and just equity in the healthcare system. Right now, it's a very critical time in America to talk about systematic racism and how it shows up in different systems and how it shows up in policing and in healthcare. And so it's something to keep at front of mind so that when we are talking about working mothers and we're talking about inequity for women of color and Black mothers in particular, we need to know that that conversation starts with a mortality rate and a huge risk and many questions asked even in bringing life into this world around healthcare. So even when you control for education, when you control for income, and when you control for where these mothers live, Black mothers still collectively fare the worst. And my personal experience shows me that it comes from a lot of bias in healthcare. And I had some of the best care providers, but the reality is that when I was going into labor, my pain was not perceived to be real. And so I was in active labor before I was taken to labor and delivery, despite already being in the care of the hospital because of the risk of preterm labor. And so because I was on a monitor that was supposed to monitor my contractions, the monitor had failed and they did not believe that I was having the contractions that I was experiencing. And it wasn't until I said, look, get me to labor and delivery or you're going to have a fatality in this room, that they took my pain seriously and started the process. And at that point, I was already in active labor for a few hours. So I had received an ice pack, a warm pack, and Tylenol before, and told that the labor contractions I was feeling was really Braxton Hicks. And so these are just some of the nuanced challenges in the healthcare system. We don't know why, don't know if I'm not saying that it's bad intent, but this is what mothers are experiencing. And there's often not a space for Black mothers to tell their story. And so a solution for that is really unconventional maternal practices, having women of color have access to doulas as part of their healthcare services, as part of their health insurance plan. And I think that'll make a big difference. So it was really important for me to just take my slot of time to talk about the maternal mortality rates for Black women. But I also want to just talk very quickly about the experience being a working mom of twins who are less than 1 year old, and they're going to turn one next month, while also leading an organization in the middle of a pandemic. This has been extremely challenging. And I think if I worked anywhere else in the world, it would be even harder, but it's been a great benefit to work at an organization that is women-led and women-centered. And while one of the only parents currently at the organization, there's still something about women's leadership that is very compassionate and inclusive. And so while it's not everyone's direct experience, they can imagine what it's like balancing a full workload and two little tots who have a lot of needs. And what we came to the conclusion was that I would have a different work schedule, and I would have pockets of time where I'm online during the day just for those face-to-face meetings. And we brought it down so those meetings are just happening a few days out of the week. And then my blocks of time around that would be based on my schedule, because childcare I'm still the primary childcare provider in the home, even though it's a two-parent home. And I also want to be the childcare provider for my daughters in this pandemic. And so it's important that organizations have policies that are reflective of the staff and inclusive of the staff. And I'm happy to say that even though I am a year or almost a year out, I'm still going to be able to access my organization's parental leave policy because they're so innovative. So I'm actually going to be able to take the month of July off and focus on taking care of my little ones. And so that is just a way that organizations can be creative in supporting the working moms in a space of equity. So I'm really excited to work at GG that's innovative, and hopefully more organizations can follow suit.